Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I am your host, Will Rucker, and just want to say thank you for joining the broadcast today. We have a jam-packed show in store for you, and this is information you are going to want to share with your family, your friends, your neighbors, and yeah, even those you don't like too much. So let them know A Healthier Tomorrow is on the air right now. Tell them tune in because they need to hear what we are talking about today. A Healthier Tomorrow is an outreach program of Community Partners for Better Health, where we are serving our community, empowering you with the knowledge, resources, and tools you need to create a healthier tomorrow. The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Flu season is here. Everyone 6 months and older should get a flu vaccine each year, especially those who are more vulnerable, like babies and older adults, and people with certain chronic health conditions. Free or low-cost flu vaccines are offered at community locations all across the valley. For more information, just call the Southern Nevada Health District at 702-759-0850 or visit snhd.info/flu. With that, I'd like to welcome our first guest. It's a great colleague, a tremendous asset to our community. Good morning and welcome to A Healthier Tomorrow.
Hi, good morning, Will. Thank you for having me.
Oh, it's absolutely my pleasure. So glad you could join. For our audience, if you could just introduce yourself and what you are doing right now with the Health District.
Sure. My name is Nelida Pelaez. I go by Nellie. I'm a health educator at the Southern Nevada Health District Tobacco Control Program. I work with multi-unit housing managers to help reduce exposure to secondhand smoke among the Southern Nevada community, specifically residents who live in multi-unit housing. I also do some outreach within the Hispanic community to promote cessation services.
Awesome. So it sounds like you got quite a full plate.
Yes, definitely. I mean, it's interesting. I mean, there's so many resources out there that are needed for our community, and we're happy to provide them.
Yeah, and I just think it's awesome that you are out there, taking the information to people who absolutely need it. One of the things that you're working on that I want to make sure we talk about today is the Smoke-Free Housing Initiative. So what exactly is it?
Yeah, well, thank you for asking that. Well, the Smoke-Free Housing Initiative is something that the Health District has been working on for many years now. This rooted from an increased awareness of the dangers of secondhand smoke and therefore a public need for housing that was free of the dangers of secondhand smoke. And so over the past 10 years, the Health District has been working with many community partners to develop a smoke-free housing directory. And that directory now contains over 55,000 smoke-free units,
Wow.
ranging, yes, that's a lot of smoke-free units now available to our community. And again, they range from anywhere from low income to luxury options. So our community really has many options now available to them. And again, secondhand smoke exposure just causes disease and premature death in children and adults and who do not smoke. So that was a big concern. One of the missions of the tobacco control program is to work with our community to protect our community basically from the dangers of secondhand smoke. And again, one of the best ways to do that is through the smoke-free housing program and policy initiatives.
Absolutely. Living in a community that doesn't expose you, I think, is step number one. And you mentioned that there are certainly some dangers to secondhand smoke. What are those dangers, and how does that impact someone that's not smoking in their home or doesn't have a guest that's smoking?
Yeah, definitely. Secondhand smoke is more than a bad odor or a nuisance. It's actually a very serious health hazard. It is a top preventable it's a top preventable cause of acute chronic disease in children. Secondhand smoke causes ear infections, more frequent and severe asthma attacks, respiratory symptoms such as coughing and shortness of breath, bronchitis, pneumonia, just a greater risk of SIDS as well. In adults who've never smoked, for example, secondhand smoke also can cause heart disease, lung cancer, and stroke. So again, going back to multi-unit housing, secondhand smoke seeping into an apartment or condominium from the neighboring units is a common problem and a challenge because of all the shared ventilation systems that exist between housing units and just inadequate door and window insulations. And it just also can travel through many different forms and ways, such as light fixtures, hallways, balconies, patio areas, and so forth. So, basically a statistic that I can give you is that according to CDC, more than 1 in 3 non-smokers who live in rental housing are exposed to secondhand smoke, and 2 out of every 5 children are exposed as well. So that's very unfortunate. I'm just going to quickly tell you about some situations that I've had to deal with personally. I get calls all the time regarding secondhand smoke concerns. And I remember a particular call from a dad who had 2 little ones under the age of 6 years old. And he was concerned because the secondhand smoke was infiltrating in his unit from the neighbor upstairs. And it was just in their children's bedroom all the time, the secondhand smoke. And when residents don't have the opportunity, the resources to just move into a different place, that really creates a big challenge and just a very unfortunate situation.
Yeah, that's really alarming. I know people are putting in filters and all kind of things now. Does that help? Does that have any impact?
No, unfortunately, studies have concluded that nothing really helps with the secondhand smoke effectively. There's no effective way to completely eliminate secondhand smoke. And yeah, like you mentioned, we've had people tell us, well, we're implementing this now. We're putting ventilation systems, or even just using things to mask up the smell, filters and aromas, but nothing removes it. The secondhand smoke, it's still there, even though you may not be able to smell it after trying to mask the smell. You can't really smell it, or it smells differently. It doesn't mean that it eliminates the secondhand smoke. It's still there. It's still causing an exposure and harm. And so the bottom line is that there is no safe level of exposure to secondhand smoke, and there is no way to completely remove it once it's there.
Wow. What about with vape or even marijuana?
Yeah, so vape is definitely a newer issue in multi-unit housing. Compared to regular traditional cigarettes, vape is a newer product. A lot of the times this is through devices called e-cigarettes, Juuls, for vape pens, and this is happening more among the younger communities, younger adults. So it really depends on the particular property and the type of community that they have, if this is going to be an issue or a big challenge. But yes, we have seen that this is a new challenge.
For apartment managers and multi-unit housing owners that are listening to this and are thinking, you know what, this is something I really want to do. I want to protect the health of those that live in my community. Is this something that they can do? Is it legal for them? How does this work?
Absolutely. Any apartment manager and owner can implement a voluntary smoke-free policy. In Nevada, apartments qualify as personal residences, so they are exempt from the Nevada Clean Indoor Air Act. However, Nevada law does allow property managers and owners to develop their own no smoking policies, and smoke-free policies can also prohibit the use of e-cigarettes, marijuana, and any other products that produce a secondhand smoke exposure. And apartment owner and managers have the right to establish whether it's a 15, 20, 30 feet minimum distance from where smoking can occur from their property. So really, there are many options when it comes to implementing a smoke-free policy for apartment managers and owners. The Southern Nevada Health District actually developed a smoke-free housing toolkit that apartment owners and managers can utilize to easily to help them implement a policy. And the toolkit is very updated with updated information, and it's kind of a step-by-step guide with answers to most commonly asked questions. And it's just a really helpful resource for apartment managers who I guess can just really utilize this to implement the policies and help them through every step of the way.
Yeah, that's what we need. Step by step, just tell me what to do so I can follow the instructions. I'm juggling a million things, but this does matter too, and I just need help doing it. So I'm speaking for the apartment managers, right? I appreciate you sharing that. So what if I'm a resident in a place that does allow smoking and perhaps I'm impacted by it? It's affecting my asthma or my children or my pets. Is this toolkit, something that I can have access to share directly?
Absolutely. We have had many residents actually call us, like I said before, with complaints about this or concerns about secondhand smoke exposure occurring in their property. They contact us and we tell them, you know what, we would love to work with your property manager to help your community become smoke free and help reduce that exposure so they can have access. Anybody can have access to this toolkit, whether you're an apartment manager, a resident, a staff, an employee who is concerned with this. You have access to this toolkit, and we are happy to work with your community that you either live in or work in, and we're happy to provide the resources and work with the property managers to help develop a smoke-free policy.
Awesome. Now, earlier you mentioned that there are 55,000 units in Southern Nevada that are smoke-free. So how does a person find that place? They're trapped in their current, home, and both of their neighbors smoke. They want out. They want to go somewhere where it's no smoking. How do they find out?
Absolutely. Yes, definitely. If you are someone who wants to find a smoke-free place to live, you can actually find our smoke-free housing directory. It's an online directory that, again, contains over 55,000 smoke-free units by visiting www.gethealthyclarkcounty.org and looking for the smoke-free housing directory list, the icon, and then you're going to find that list, directory page. You're going to go to it and you're going to be able to see the list of different units we have, and the list is actually a really good resource because it's listed by different regions. So if you're looking for something in a particular area of town, you can easily click on that area of town and it'll tell you, it will list the different properties available within that specific area. So hopefully it's a good resource.
Sounds like it. That's awesome. So I know where I want to live. I can just click that region and up pops units that I can choose from.
Exactly.
Perfect. Well, Nellie, I want to thank you for joining the show today and for sharing this great information. Before I let you go, I do want to ask this last question. And I'm asking because, in my perspective, the best way to create smoke-free housing is to help people that are smoking to quit. So are there resources available for individuals who are using a tobacco product, whether it's traditional cigarettes or e-cigarettes or vape or Juul? Are there resources available for them that can help them quit?
Absolutely, Will. If you or someone you know wants help to quit smoking or vaping, you can call the Nevada Tobacco Quit Line, which is a free phone-based service available to Nevada residents who call from a Nevada area code. And the number to that is the 1-800-QUIT-NOW. Again, a free phone-based service for anyone 13 years of age or older. And the Nevada Tobacco Quit Line is a great resource because it provides free services to any qualified individual based on the need of that individual. And they help you develop a quit plan, and they have a quit coach. Quit coaches are trained professionals who understand your needs, who understand your concerns, your struggles, and they work with you, whether it's through the phone-based service, but they actually also have an online service now where you can do this online if you feel comfortable doing that interaction online as well. They have that service available. And again, like I said, they help you develop a quit plan, and they establish goals for you. They work with you at your own pace. And so I've heard it's from what the experience of other people have said, it's a great experience for them. They help them develop, again, a tailored plan for each person.
Awesome. And let's say I've already tried to quit. I've tried to quit on my own 5 times. What hope do I have, and how does the quit line make this more of a reality for me?
Well, it's if you've tried quitting 5 times, what we've heard is that you have to keep trying. It's not easy, right? It's definitely not an easy thing, and it may take several attempts. Most people that quit do have to try many times before they are successful. So again, to your question, it's just the quit line understands that. The quit coaches understand your struggles. They have experience with this, and they're trained on that, on how to help you begin with your individual needs and meet you where you are in your quit process. So definitely they work with you one-on-one, and they provide great advice, services, and again, they have resources such as nicotine patches, lozenges, medications. We've heard from many residents that these things are very expensive when they try to get them on their own, maybe even without insurance. And if you go through the quit line, they may be able to provide that for you at no cost.
Wow. I mean, that's a huge benefit right there, just starting with the medication piece. So
Exactly.
awesome. Is this something that like apartment managers could refer residents to or partner with in any way?
Absolutely, Will. So apartment managers can also utilize this resource for their residents. What we recommend that apartment managers do is when we implement a smoke-free policy and we help them implement their policy in their community, we also try to encourage them to utilize cessation resources as a way to help those residents who may not be able to comply with the initial step of the policy. And this is a great way to help both property managers and residents, right? Because sometimes managers may need additional resources to help their residents really follow through with the policy. And this is a great way to do that. Offering their residents the resources is just a caring way to help them through their implementation process. And again, it's a win-win for everybody. And so we do offer these along with the step-by-step guide, along with all the other resources. We provide these the 1-800-QUIT-NOW resource to managers so that they can help their residents quit, and they can even ask for help from the American Lung Association, which I know has been very, very kind, and also offering in-person cessation classes. And we have partnered up with them in other situations where residents may need that, and they come with us, and they also share very valuable information. So just again, a lot of great resources and comprehensive services to those communities that need it.
Yeah, it sounds like there's no reason for someone not to at least try. And so, Nellie, I know I said that was the last question, but I've been preaching for 20 years, so I get 3 closes on this. What is if you had to just make it really super clear, like a billboard, one sentence, why should people take this issue seriously?
I believe there is no better time than now to live smoke and vape free. I believe every person living in multi-unit housing deserves to breathe clean clean smoke-free air. And again, there's no better time to be healthy, breathe easy, and live smoke-free.
All right. The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. This flu season, help keep yourself, your family, and our community healthy by getting a flu vaccine. It's the best protection against the flu. Free or low-cost flu vaccines are offered at community locations across the valley. For more information, call the Southern Nevada Health District at 702-759-0850. That's 702-759-0850, or visit them online at snhd.info/flu. And with that, I'd like to welcome our next guest. We've got a double dose coming to help us to understand what is going on with the vaccines and what it is we should be doing in our community to stay safe. So, welcome to the show, Alisa Howard and Ender Austin III. Good morning.
Good
Good
morning.
morning. Thank you for having us.
Oh, yeah. So glad that both of you could join. This is truly a treat. Alisa, you were with us on A Healthier Tomorrow at the start of the year, so welcome back for the fall. And
Thank
Andrew,
you.
I think this is your first time with us, right?
On this platform, but I've been with you, shucks, Will. I think for 9 years I've known you now. Wow.
Yeah, yeah.
You didn't know, bro, not me.
Awesome. So you got some amazing things happening where you are providing vaccines for our community right where they are at Nevada Partners. Tell us about that.
Yeah, so back in March, Nevada Partners began partnering with a lot of really great folks, including Ms. Howard, to make sure that we were bringing vaccines into the community. A lot of what I heard and a lot of what we saw throughout the nation was that folks were having to travel a ridiculous distance to find vaccine clinics. We also know that people, if they're able to go to places that are familiar to them, places that have some sort of resonance with them, it's a lot more comfortable, right? If you know it's coming out of grandmama's house, you feel a lot more comfortable than somebody you ain't never seen before. And so, especially with knowing all of the issues that folks of African descent specifically, but Americans as a whole, had with the hesitancy with the vaccine, we thought it prudent to bring this information and this resource to Nevada Partners and couple that with a lot of the great work that the Health Pillar is doing. That included webinars, that included actual outside in-person events and all sorts of other methods to make sure that we're spreading the word about this vaccine, that it is safe, that it is healthy, and that you need to get it.
That makes a ton of sense, and I'm so glad that you are doing that. I've done probably 30 webinars at this point on the vaccine, and admittedly, I'm tired of talking about it, but I'm still talking about it because it is just that important. So, Alisa, from your perspective, what's happening? Why are we still at such a low number of vaccinations?
So, with my company, Minority Health Consultants, what we do is we're currently doing outreach to the minority community, right? Specifically Black communities behind COVID and flu, influenza, because they're both hitting the community at disproportionate rates right now. So, what I'm doing is I'm working with the Office of Chronic Disease and Prevention over at the Southern Nevada Health District. And through them, we are working with Immunize Nevada because it takes a team, right? Southern Nevada Health District was very overwhelmed when the pandemic happened. They only have a certain amount of people who can even do vaccinations, who are even certified to vaccinate people, right? So they had to reach out to a third party, which was Immunize Nevada. And so that's how all of that kind of came about. Now we're working with UNLV's Nevada Minority Health and Equity Coalition to do the same exact thing, just for businesses and specifically getting into the community directly. The Office of Chronic Disease is working with churches. So there's two different efforts happening, but it's coming at the community simultaneously to be able to effect, bring education to the community so that they feel better about getting the vaccination. And if we're hitting it from both sides, if they're seeing it at businesses with UNLV's sub-grant, but they're also seeing it at churches, they're seeing it everywhere. It just makes more of a better impact. And so that's kind of what we're doing. So my team is going out and setting up vaccination clinics at different businesses with different business owners, because what we do is we see them as leaders. We see the business owners as leaders. And if the leader is the one, if you like my food, you like coming to my restaurant, then hopefully you'll subscribe to some of the same things that I'm subscribed to, which is getting vaccinated. And so that's kind of what the push is behind that.
So if a business wants to bring this to their location, how do they get connected?
So basically they would just get in contact with me at minorityhealthconsultants.com, and that's Alisa Howard, or you can contact me at 702-674-6282. That's my direct phone number, and we can get you set up. So basically what would happen, because I'm all about the logistics of everything, is that you will call me, let me know what business you are. And I will, look it up. We'll have a conversation about kind of like what you're seeing. Are people coming in not wanting to wear their mask? Do you need more education materials? What can we do to actually help you as a business owner also, right? Because it is about that business owner as well. We want to make sure that everybody is safe while they're eating, right? And so I will talk to that person, and then basically I'll get in contact with Immunize Nevada and get a vaccination clinic set up. And we can even do something where it's an event, where maybe it's an open house, or maybe it's a, I don't know, like a little event right in front of their store or right in front of their restaurant, something creative just to draw people in, because you do have to add a marketing aspect to this. People aren't just listening to get the vaccination anymore. You have to reel them in with food, with incentives, with things that they actually want to do and hear about.
For sure. So give us that phone number one more time.
702-674-6282.
As a man of faith, can you speak to our faith community about why the vaccination is important?
Yeah, I think that Jesus is very clear that the way that we are to show our love is not just in the way, and I'm Pentecostal holiness, so we're going to shout, dance, holler, and scream. But it's not just in the way that we do that, but the way that we show our love and our devotion to the divine is a way that we love one another. And one way that we can show our love for our brothers and our sisters is by protecting them. A lot of times people make my mask or my vaccine, etc., something that's political or something that is judgmental, etc. But I know this right here. I have a loved one who is 20. She'll be 21 in a couple months. She's vaccinated. She unfortunately had a breakthrough case. But this is the thing I know definitively. As a 20-year-old who's relatively healthy, she has a really good chance of beating this, right? If she were to pass that on to someone who is older than she, or someone who's even her same age with comorbidities, who may be obese or may have diabetes or something of that, if she wants to really show her love for the divine, she shows it by protecting the least of these. And sometimes we think the least of these is only those who are in a specific category, but at this time when we're talking about COVID, the least of these are the folks who cannot afford to take off work. The way you show your love for the least of these at this time when we're talking about COVID needs to be protecting yourself and protecting them.
Perfectly stated. So thank you for sharing that. Shout out to Nevada Partners for hosting these clinics, and to all the churches that are part of this, and now the businesses that are doing this, really truly loving our community by protecting ourselves from COVID-19. Also, as Alisa mentioned earlier, get your flu shot. It's that time as well. You can actually, if you're not wanting to go 2 trips, you can do them on the same time. So get them both. Stay protected. Stay healthy, because you absolutely matter to our community, and we need to keep you around as long as we can. So we've talked about this being so important. People are ready. They want to come right now. But when is the next event you're having?
Yeah, so on October 27th from 11 to 2 at 690 Westlake Mead, Nevada Partners Community Learning Center, we're going to be there, and we're going to be vaccinating folk. Why this is so important, Pastor Will, is at the start of this, we were getting about 300 plus folks showing up. The challenge that I had is a lot of these people were driving over from the other side of town, but we redoubled our efforts to make sure that we're reaching out to the people right within that walkable community of the historic West Las Vegas community. But those numbers have dwindled down to 10, 15. And so on October 27th, from 11 to 2, we're so excited to be having another clinic, and we believe that we can serve the community well by protecting ourselves and protecting each other.
Our appointment for anything needed?
Pre-registration is not needed. It will be wonderful. It makes it a little easier to get through, but we'll have a team on site, and English and Spanish help you get you registered.
Go ahead.
And one thing that I just wanted to add is that this is really important to have health access in the community. I know a lot of people don't think that it's a big deal, but people had to fight in legislation. People had to fight with the state of Nevada to get vaccination clinics set up directly in the heart of vulnerable communities. So this is a really big thing. This is something that people fought for. We talk about Martin Luther King, and we talk about different heroes of ours as African Americans, right? Well, there's local heroes that are doing this fighting for us behind the scenes. And so we need to show up as a community and show people who did not want to supply this need to us, that we are here, we are getting vaccinated, we hear this message, and we want to protect our community as well.
Well, that is our broadcast for today. This has been A Healthier Tomorrow. I am your host, Will Rucker, and thank you for joining the program. As I always remind you, you are not just a drop in the ocean. You are the ocean in a drop. What you do matters. So live compassionately. And of course, get your flu and COVID-19 vaccines. We'll see you right back here on KCEP for A Healthier Tomorrow next month. Thanks for tuning in.